Thank you all for joining us today. My name is Sasha, and I was so happy to get in contact with Dr. Rohit Moghe, an ambulatory care and population health clinical pharmacist, certified diabetes care and education specialist, and yoga and meditation teacher. His resume is quite impressive to say the least. He has spent his professional career focusing on health and wellness, and he is here today to share some of that wisdom that he coaches his patients on with us. Welcome, Rohit. Thank you so much for joining us today.
Oh, good afternoon. I'm on the East Coast, so it's afternoon here. So good afternoon and good morning, and good evening to whoever is listening.
Yes, absolutely. Thank you, everyone, for joining. So, I gave a bit of an introduction of who you are, but how would you describe your approach to your patients and what are your specialties that you focus on?
Right. I mean, you mentioned a few of them. So I am a residency trained pharmacist. So basically, I did a residency alongside physicians. I have a master's in public health. I'm a certified diabetes care and education specialist, newly minted 200-hour yoga and meditation teacher. And I also have additional certifications which you guys can see on my LinkedIn. So I'm actually certified in a area of personalized medicine that is getting a lot of press lately. It's called pharmacogenomics or pharmacogenetics, where the genes that you display can dictate which medications may or may not work well for you. Now, that's not always set in stone because the genes are what we are coded with, and how those genes, the codes, are active can dictate, how you may respond to medications. You probably have seen things on personalized nutrition therapy with the same type of genetic concepts. And now I've also seen, cannabis possibly being dosed that way as well. And when I mean cannabis, I mean both hemp extracts, which I promote, as well as quote unquote medical marijuana.
Wow, that's incredibly fascinating. And I'm sure very interesting to a lot of individuals in our community as they try to navigate through heavy pharmaceutical lists and cannabinoid therapy. Um,
Absolutely. Yeah, I mean, one of the things, like from my patient care approach, I really focus on, I know there's a lot of people on medications. In some of the medication lists, 20, 30, 40 meds, what we considered polymedicine or polypharmacy, as a term you may have referred to. There's many different definitions. Some older ones said five or more. But now people with, the fact that you have diabetes associated with that is high blood pressure and high cholesterol, and you could easily be on 10 meds at that point. And then you add on other medical conditions, it just keeps adding more and more. So my philosophy has always been, what can I do to help you get to a state of health where you no longer need us? I want to basically liberate my patients from the incessant need for medical interventions. That includes my kind. If I can help you get off meds, hopefully save you some money, save you some side effects, I would love to do that. But in order to do that, I need to go back to medicine 101, which is lifestyle as medicine. Use medications where necessary, but really move you to this through this realm of wellness and lifestyle medicine, and help you get better. If we have to use digital technology, digital therapeutics, and some apps along the way, fine. But I don't want them to be used, with blind faith. I want them to be used judiciously. So when I mention lifestyle medicine, what I want everyone to Google at some point in time is the American College of Lifestyle Medicine, or lifestylemedicine.org. Within it, the definitions state that we can use all six of these interventions, not just to treat, mitigate, and in some cases, even reverse medical conditions. Now, that kind of really attracted me because this was my ethos from the beginning. So it starts with nutrition. So, what's on your plate? your activity, how do you manage stress, how much restful sleep are you getting, are you doing some illicit substances that may be harming you, and focusing on your relationships. So with that being said, I wanted to put a segue into the lifestyle week that is actually starting this coming Sunday. So from May 30th, 2021 through Saturday, June 5th is Lifestyle Week. And you can go to lmweek.org. And what we're focusing on as part of American College of Lifestyle Medicine during Lifestyle Week is we want people to be engaged. We want people to be on social media. We want people to eat plants, focus on eating plants, keep moving, enjoy movement, something that you love doing. And if you want to make it social with friends, that's awesome. Sleep well, be present, stay calm, and most importantly, as a result of all of this, inculcate love, love of everyone. So this is, imagine a bunch of doctors, nurses, pharmacists, actually proclaiming this on a daily basis. And this is a growing organization. I'm a co-chair of the Pharmacist group within this organization. And I do promote its principles with all of my patients. And I can give you an example of how that has helped.
Yeah, absolutely. An example would be great. And I like that I've noticed on your social media channels that you have been a proponent of plant-based diets, or just incorporating plant-based into your eating habits. So how do you help your patients to incorporate that into their lives and becoming predominantly plant-based? It can be difficult for some to make that switch. So what benefits maybe have you witnessed that you can help to highlight as this is a reason why you might want to think about that switch?
Absolutely. Basically, any medical condition diagnosed by a doctor or a nurse practitioner or a physician assistant, and now increasingly pharmacists, dentists, anyone with a medical degree that is diagnosing you with stuff. Obviously, this is going to be mostly physicians, but every single disease has one important thing in common: inflammation. The degree to which this inflammation happens is varied between diseases, but at the top would be cancer and autoimmune diseases like rheumatoid arthritis, inflammatory bowel disease, Crohn's disease, ulcerative colitis, and other rheumatologic diseases. The inflammation is just through the roof. So think of it that, figuratively speaking, inside your body, it's on fire. Uh, and all these inflammatory factors are moving around. If you feed the body things that are going to keep it inflamed, such as animal-based foods, it's going to keep revving it up into overdrive. If you want to put out this fire, you're not going to put out a grease fire with water. You're going to put out a grease fire with something else. You're going to put out an electrical fire with something else. So that's why our fire extinguishers are A, B, C, and not just A or B or C. And that is why I look at, plant-based dietary pattern as the most important thing. So me personally, I grew up vegetarian. As an immigrant to America, I adopted the standard American diet, also known as SAD. And over time, I started experiencing problems associated with that: high cholesterol, high blood pressure, gaining weight easily. I came across a bunch of different sites in the early 2000s from the Physicians Committee for Responsible Medicine, and they talked about plant-based nutrition, and I got intrigued by it. I delved deeper into it, and I incorporated a lot of the things. And I started noticing these effects in myself. And I said, well, if it's good for me, why can't it be good for others? And that's exactly what I do with patients. So with most of the patients, I have them first watch documentaries and then react to them. as they're watching these documentaries. So the three that are on my list are, in order, are going to be Forks Over Knives, which came out in 2011, so 10 years ago. They have a wonderful website, a wonderful app, and a great cookbook. Um, then the next one is Eating You Alive, that came out in 2016. And then a bigger one that came out in 2019 is called The Game Changers. And The Game Changers, again, just because of social media and how active we are and podcasting, was, received acclaims on both sides. It got hit hard from the meat eating clan, and it got lauded by the people on the plant-based side. But this documentary does raise an issue. We should really think about where our food comes from. We should really be careful about what we've been told about protein. And a lot of times I get patients who ask me, well, if I eat all these plants, where am I going to get my protein? And I said, protein is not your issue. It's the lack of fiber that's your issue. So anytime, I get one of those bros that says, where'd you get your protein from, bro? And I said, where'd you get your fiber from? And they have no answer to that. It's the fiber that is most important. It is the fiber that reduces the risk of certain types of colon cancers, and also heart healthy, and removes the cholesterol from our body. So plant-based dietary pattern is known to be anti-inflammatory, just because of the wide variety of different plants that you're eating. And if you eat with the rainbow, the concept of the rainbow with different colors of plants on your plate, well, you're getting all the different chemicals that are known to be antioxidants that are going to be flooding your body with essentially plant medicine to help you overcome a lot of your disease states. So, it's a good question you asked. I mean, I in the world that I work in right now, I work for an accountable care organization. And you see my title there as a population health pharmacist. So Medicare and insurance companies say, hey, look, these patients are all whose blood sugars on average are about 300 milligrams per deciliter. Now, normal is somewhere around 90 to 100. And so that correlates with a diabetes value over a 3-month period called A1C. So any patient or person whose A1C is greater than 9, that's the Medicare beneficiary that's in our contract, the insurance company says, hey, take a look at these people. Can we help them? Well, guess what? How they want them to be helped is they want them on more meds. Well, one of the things that I focus on, meds are good, but if you take them for 5, 10, 15, 20 years, there is not one clinical trial that a pharmaceutical company has done that was meant for meds to be taken for decades. And that's why after 15, 20 years, we start seeing these medications cause more problems than anything. A classic example are proton pump inhibitors. Larry the Cable Guy is not a role model for what Americans need to be eating. Larry the Cable Guy should be put on a plant-based diet, and maybe he won't even need the Prilosec. So that's the real issue. So a recent patient that I've been working on, she came in, her blood sugars were in the 320s. She had lost her husband in late 2019. She had suffered a massive heart attack in early 2020, and her mood, her health, her everything was in the gutter. Well, I came along, I coached her through it. A lot of it is still 99% of it is her. She did it. So within 1 month on a plant-based diet that she was very reluctant to do, she grew up meat and potatoes on a farm. She was reluctant to do, 73-year-old lady. Tell me that an old dog can't learn new tricks. She did.
Yeah.
Her average blood sugar after 4 weeks dropped from 320 to 150.
Wow.
That and when she went after 3.5 months of that initial A1C, which was nearly 10, it dropped by 3 percentage points. Um, so much so she was so excited that she's like, I can't believe I've never had, she's like, I've had diabetes for 15 years. I've never had an A1C around 7. I've always hovered in the 8s, and now I went to 10. And she's like, I'm starting to believe in this plant-based diet. Well, guess what? It has a ripple effect. Her granddaughters are in, her daughter is in. And now she is coaching, friends and family in her social realm. And
Mhm.
she's lauding all the benefits that she's received. Her cholesterol tanked. She got off her antidepressants. She got off her sleeping pills. I did try to encourage her for some of her pain syndromes to use a hemp extract. And she used it for a little bit, and then she's like, not for me. And
Mhm.
she's like, I'm just trying to try to focus on getting off meds.
Yes.
So this is the kind of stuff that plant-based dietary patterns can do. This is just one recent example.
Mhm.
And when she told me her A1C dropped by 3 percentage points in 3 months, she was completely flabbergasted. And I said to her, "Is like, I want to celebrate your win because you did this.
Mhm.
But I will be very honest with you. What I saw happen to you is not unusual. If you stay on the standard American diet, you're going to have more pills put on you and possibly insulin, which is what her primary care doctor was, quote unquote, threatening her with."
Oh man.
So these are the types of things that I've seen with plant-based dietary patterns. Anyone of my patients who've adopted it have, experienced benefits, reduced inflammation, reduced cholesterol, reduced weight. And honestly, even though they may not be shopping at Whole Foods or some of these higher end supermarkets, Sprouts or whatnot, they're
Mhm.
saving a ton of money just by not buying a lot of meat and all the processed stuff that goes along with cooking and serving meat.
Absolutely. I like that you come from it with an educational standpoint, watching these documentaries, which Game Changers also has great recipes. I actually just made their barbecue chickpea sliders this weekend, so it's funny you mentioned that. And you mentioned hemp and suggesting it to your patient. So I know that you have spoken about hemp products before. So how do you help your patients incorporate hemp products into their lifestyles? And this might speak to the anti-inflammatory uh, therapeutics as well. But who do you find that this therapy is the most helpful for? As in, what conditions might cannabinoid therapy products benefit?
Absolutely. So I'm in Pennsylvania. So Pennsylvania has medical marijuana law, and we have about 21 conditions for which a patient can obtain medical marijuana. We do not have recreational, although across the river in New Jersey, they approved recreational marijuana last year. However, that is not operationalized for any person to obtain. So we have medical marijuana, and then we have over-the-counter hemp products. We have vitamin shops, local food stores, local health food stores that a lot of them have CBD or hemp products there. Um, the problem really comes down to um, people either love it or hate it. Unfortunately, the problem with hemp is it gets coupled with its cousin, marijuana.
Hmm.
So this is how I target. I target people who have an inflammatory condition, so rheumatoid arthritis or any rheumatologic disease, patients who have pain syndromes, autoimmune diseases such as lupus or inflammatory bowel disease, and people who are taking various doses of opioids. So this is this. Once I see these individuals, I target them and say, "Hey, how open are you to try a cannabis product?" And I explained to them, you're in Pennsylvania, these are your options. If you wanted to go with over the counter first before you go to your doctor to ask for a script to go to a physician practitioner in Pennsylvania who is going to clear you. So not all doctors are those that would clear a patient and sign off on the medical marijuana card in Pennsylvania.
Hmm.
So they would have to go through their regular physician to get a script to go to another physician to have that clearance. And those physicians who provide the clearance can charge anywhere in the upwards, and it's all cash business, anywhere from $250 to $500 to $700 to medically clear them so that they can apply with the state for the card. So that's a lot of money up front. And then once you get into the dispensary, the good thing in Pennsylvania is a lot of the dispensaries are staffed by pharmacists. So those pharmacists have the requisite education to assist patients. But if the patient doesn't divulge enough information, again, they're not carrying their whole medical record with them all the time. So that pharmacist can be only as helpful as the information that they have. But I can be even more helpful because I usually have access to their full medical record. Once I have access to their full medical record, then I can say, man, you've been on opiates for all these years. What do you think about taking that? How open are you to trying something else that may actually have benefits beyond just treating your pain? It might be good for your inflammation. It might help you sleep better. It might help target anxiety. So if I come across patients additionally who have anxiety or sleep issues, and they're on the Z drugs, the Zolpidem and Sonatas and whatnot, I usually recommend for them to consider using hemp products that are over the counter. But then the next part is, okay, doc, I went to my GNC, they don't have it. Or I went to the vitamin shop, they had like 15 different brands, and the guy recommended Uncle Bud's, and I'm like, oh God. That's my problem, is people recommending products to patients that have no business. They're not asking them what meds they take. They're not asking them, what their health conditions are like. And again, these are store employees. I don't know to what extent they get that training. So, but I have that training. I have done certification in cannabis for clinicians. And I'm constantly learning, because this is the first therapeutic category in my career where the consumer use and demand has not only outpaced medical research, but it has completely caught us clinicians flat-footed. I can't think of anything in my lifetime that has caught us clinicians, us providers, completely flat-footed. And that's why a lot of docs out there say, I don't know, I don't want to go down this route, I don't recommend it. Now, there are obviously benefits to it, but there's also misinformation and misunderstanding in the community about, the age-old concept, the Texas mindset. I'm not picking on Texas here, but big is better, more is better. It's not always the case. More is not always better. Bigger is not always better. More THC isn't always good. And more CBD isn't always good. And this is an area where the key concept of start low, go slow, and possibly even stay low for your conditions is a good idea. And that's why it's good to work with a pharmacist or a physician or a nurse who's or educators like the Realm of Caring that are well versed in this area and can educate patients through this. So for me, this is like conversation starter is these specific medical conditions, then finding out the openness of the patient to want to try it. I often find over here that a lot of people think that because of their goody two shoes, they would rather not do quote unquote drugs that are quote unquote illegal, but then they're drinking, alcohol like out the wazoo. So for me, it's like, okay, there's a discrepancy here. So I utilize motivational interviewing to kind of build that discrepancy and kind of help them navigate through, why it might be in their best interest to try. Yeah. And I let it simmer for a little bit. And after they've had side effects with their opioids or other pain meds, or a lot of times, so what I tend to see is opioids followed by benzos, followed by skeletal muscle relaxants like Flexeril. and others like that are like the trifecta. A lot of these people, low back pain or other types of pain, they get prescribed opioids, and their anxiety is still not addressed. Then they get prescribed the benzos, and they're having muscle spasms, so they get prescribed these muscle relaxants. And the actual real guideline directed therapy for these people is get up off your ass and move. So when I target these individuals, I open the idea. I said, I will be 100% there every step of the way to help you determine the best product for you, and allow you to titrate it to an effect. And then also monitor you for drug interactions, because the good thing about hemp products is, if it's a good product, well made, you are getting pharmaceutical quality whole plant extract. And I don't recommend like broad spectrum or anything like that. I'm like all about the entourage effect. Get the full spectrum product. Yes, let there be a little bit of THC. And it is legal according to the federal law. Will overcome any issues, legal issues that come about as a result of that. But more importantly, I really want you to benefit from the product, and I will monitor you for drug interactions, because the hemp products do interfere with a lot of antidepressants. So if that's happening, then I know, like, okay, you may want to consider lowering your dose of your antidepressant, or using a lower dose of hemp extract. And I see where the person is at and where they want to make that adjustment. What would they rather go up on or use more of, as opposed to the other? So if they want to come off the antidepressant, I'm like, great, awesome. Let's up the hemp extract in a smart way and slowly titrate your medication down, but always keep your doctor abreast of what you're doing. Um, and also, I'm making sure that the mental health support, the counseling component that's necessary, is also there. A lot of times I wind up doing it. I was never trained in pharmacy school for that, but over the years, these are the skills you pick up. So that's kind of how I look at identifying patients. Then the next question that you're probably wondering, okay, which product do you recommend?
Yeah.
And the thing is, now there's a ton of products out there, thousands, right? So I've been recommending hemp products, especially for insomnia in the elderly, for the past 5 years. And the products that I had originally started recommending, because that's what was available in my area, was Charlotte's Web, which is one of the groups that you guys work with, and CV Sciences plus CBD oil. Those were the two things that I was recommending. And it was a personal preference, which the patient wanted to use. But I usually started off on the lower end, and I help them titrate it very slowly and try to stay low for insomnia. I like the CV Sciences product a little bit more because of the fact that it came in a spray, and they could titrate however. So for me as a pharmacist, I have an issue with, droppers. For patients, like for me personally, I know exactly how I'm looking at it. I know what to do, but a lot of times, like, I have a problem with that for patients. So if I can get a product that is a little bit more precise, that's fine. But if a patient wants to say, you know what, I'm fine with the drop, I'm like, all right, fine. You like this product, you got a good deal on it. Let's stay with it. This is what you should expect, and this is when you should expect it by. And this is how we would go about titrating one up and one down. But now, so a lot of people, doctors, especially when they're recommending, they're saying, "Oh, look at the certificate of analysis." I'm like, that's great if you are a consumer, but as a healthcare professional, you need to do your homework. Look beyond the certificate of analysis. Go to the company's website. Engage with the conversation with the people at the company, saying, hey, I am a healthcare professional and I am interested in recommending your products. And I want to understand your whole process, from how you plant that seed in the ground, how you grow that plant, and how you extract it and how you bottle it and how it's getting to the patient. So for me, keep it simple from a manufacturer standpoint. There are a lot of extraction methodologies. I want to make sure that they're not using hydrocarbons like butanes and hexanes. I
Mhm.
want to make sure that their extraction methods are as clean as possible.
Mhm.
If they are using any chemicals, alcohol would, ethanol, for example, would be my highest and lowest bar. That's like, I don't want you using anything other than that.
Mhm.
And then the extraction method is very important. So even when you pay attention to a certificate of analysis, and I noted that with a CBD brand that a colleague of mine was using, and I said to them, okay, let's go take a look at their certificate of analysis. We went on the manufacturer's website, we looked at the certificate of analysis, and luckily they had posted them all from when they first started to now. And guess what? They change vendors in the labs that they use. So that's a red flag for me. And with the new vendor, okay, so fine, you change vendors. What is your new vendor doing that your old vendor wasn't?
Right. Some transparency there.
Transparency,
Mhm.
absolutely. So guess what? This particular CBD manufacturer did. The new vendor tests a lot less stuff. They're not testing for the pesticides. They weren't
Mhm.
testing for the other cannabinoids that the previous vendor was, and they weren't testing for heavy metals or anything like that with the new vendor. And I'm like, wait a second, this is a red flag for me, because now you may have switched a vendor because it's cheaper for you. That's fine, but what are you getting from that testing? Is very important. So that was a big red flag for me. I'm like, why are you even recommending? Because they came in and they have a lot of people with PTSD and anxiety and all this stuff, and it seemed like it was legit. They lured me with the COAs. I'm like, you need to take a look at the COAs even deeper.
Mhm.
So that's a very important thing, and also looking at what type of support do you provide your consumers. And if you don't feel like you have the expertise, but you know your products and you know them well, but you're willing to kind of use a third party like Realm of Caring, that's fine too. That in fact might be better, because at the end of the day, a third party is always going to have a more independent look on educating patients.
Mhm.
And then the other things come to cost. Um, so the same vendor that I gave you the example of, they're cheaper, but the thing is, like, their tinctures are 500,000, 2,500. And they say, well, if this is not working, keep doubling the dose, keep doubling the dose, keep doubling the dose. And I said to my colleague, I'm like, well, if you're doubling the dose, that's fine. I hope you understand what that means. And I said to him, medical professional, MD degree. I said to him, first of all, here's a few myths. The CBD that's in here doesn't even bind to the CBD receptors. You need to know that. That's pharmacology 101 about any hemp extract. Yes, there are CBD1 and CBD2 receptors in our body, but there's a whole host of other receptors that interact with endocannabinoids and phytocannabinoids from hemp extracts. You need to understand that. He wasn't aware at all.
Mhm.
And then the other thing that I said to him is, the CBD in here, just all in general, all the hemp extract, pretty much very, very low bioavailability, 6 to 10%. And, and this is where pharmacists are experts. We are experts in the two key things that separate us from physicians in pharmacology: pharmacodynamics and pharmacokinetics. We know this stuff. This is bread and butter for us. And when we mention that, we basically, no doc can argue with us on it. Like, all right, you win here, or you have a point. I need to reconsider.
Mhm.
So just because a product has more CBD in it doesn't make it better. What you need to look at is, how are they formulated it, and how have they formulated it to help you absorb the best. So it really comes down to at the hemp processor and manufacturer, what is the R&D that they have invested in into getting this product to be the best product?
Mhm.
And so recently I had a conversation with another brand that you support called Stratos.
Mhm.
And Stratos is an amazing brand because it's pharmaceutical chemists that came in and reformulated the whole thing for best absorption. So Stratos was kind enough to give me some samples. I used them. And that's the other thing is I self-experiment with a lot of the CBD brands. Just so I know what I'm feeling and I can explain those things to patients.
Which is great.
Um,
I bet not a lot of doctors do that, I bet. So
right.
that's
So the thing is like, it's kind of funny, right? So hey, I'm not only the client, I'm also the patient, and I'm telling you how this works. We don't get to do that with all the drugs. We can't do that with opioids legally, but we
Mhm.
can with hemp products legally. And I feel that if I self-experiment and I understand its effects and its benefits, I can make recommendations to patients that I come across. So
Mhm.
Stratus's products are very clean. I tried their full spectrum ones, and this is the first company that has been able to tablet CBD. The first company to tablet a CBD. And even better than that, each tablet is scored so you can cut it in half.
Mhm.
So if you are dose titrating to an effect, or you're using a smaller dose just because you know from a clarity and concentration and an anxiety treatment perspective that dose works well for you, you have an option. And it's dosed exactly. A half a tablet, you're good to go. Their tincture only comes in one strength and is formulated in a way to help with that bioavailability absorption. Now, the only thing I have to say about bioavailability is still not many companies that make hemp products out there, um, study bioavailability as well as they should. So a lot of it winds up being theoretical and also a marketing ploy. So from my perspective, it really is very important to get a trusted partner. And I think Stratos for me it has been a good partner. Um,
Mhm.
so that I'll stop there. That's how I kind of go about with hemp products is how I
Mhm.
identify people, and then how I identify the products themselves. And then knowing fully well that I'm using a full spectrum hemp extract, that looking out for drug nutrient type of interactions.
Yes, absolutely. I like your emphasis on the quality of the product because that is also something that we are large proponents of. And then encouraging your patients to do their own homework and call and ask those difficult, annoying customer questions, or what people would say are those, annoying questions. But you're as a consumer, you do have a right to know how your product is processed, what's in there. You have a right to know all of that. So that is incredibly important. I'm glad you
Absolutely.
mentioned that.
And a lot of times when you get these products that are like kind of, oh, we've taken the THC out, or we've taken this out or that out. You know what actually happens, and I learned this from an extraction chemical engineer. They separate everything out because they can't just pinpoint one or the other. They have to separate everything out. Then they take those separated quantities and put it back in.
Mhm.
And that's how they're able to say, well, I have this specific thing in there and that specific thing and that specific thing there. I formulated it for your sleep or your anxiety or your pain or this or that.
Mhm.
And when they do that, oftentimes they have to intervene with additional chemicals, which may or may not be safe for you to do that. That's why, for me, you know, um, the full spectrum extract is where I'm at. I'm just going to stay there. I'm not going to deviate, at
Mhm.
least for now, until better science and better better research indicates otherwise.
Makes sense. So, to speak to other lifestyle changes that could be beneficial to our mental health, you spoke a bit about depression and anxiety. You also teach yoga and meditation. So, can you speak a bit to how that could help our mental health and well being?
Yeah, absolutely. So I wound up doing an online yoga teacher training program in the fall of 2020. And I basically, I was on furlough for like 8 weeks, last year, which was awesome because the timing of it was towards the end of summer. So I was able to enjoy my summer. But I also asked myself the question is, what in my life do I feel I want to do for my personal growth? And if there was one thing, I felt that I needed to reconnect with yoga again.
Mhm.
And I needed to put myself through education and training that puts me on a path for a lifelong practice. So, without offending anyone, yoga is not, some bendy blondie, in Lululemon doing poses. Yoga is really union at a higher self between you and whoever you consider is your spiritual master, whatever or whoever you want to call it. And in order to do that, you first start with your body, that then you connect your mind, and then you connect your spirit. So one of the most important practices within yoga is the meditative practice. Um, the practice that I actually do with every patient is deep diaphragmatic breathing. And there are many different ways to do deep diaphragmatic breathing. One of them is the simple 4-4 method. Our breath has 4 components. There's a inhalation, slight pause, exhalation, and a slight pause. And you can vary any of those components. So there's a 4-4 method, which is breathe in for 4, breathe out for 4. And that's the technique that's literally the first thing that you will see in the app called Calm. There's box breathing method, which is what is used by the Navy SEALs. And basically it's breathe in for 4, retain for 4, breathe out for 4, retain for 4, and then you repeat those cycles. There's a method that Dr. Andrew Weil has made famous called 4-7-8. Breathe in for 4, retain for 7, exhale for 8. There are many other things. Plus, there's alternate nostril breathing and the different types of breath work that yoga classes and meditation classes tend to focus on. But it really comes down to our breath. If I see somebody breathing up here, upper chest, upper clavicular, that tells me something, that they're anxious and they need to breathe. So, for some of the people who may be interested, there is a book out there. It's called Breathe by Belissa. It's Melissa instead of with an M, it's with a B. Belissa Vranich, Vranich. So she's a PhD psychologist that was noticing all her patients with PTSD and bipolar and depression were like all breathing heavy up here. When you breathe heavy up here and you're not getting deep, guess what? Your anxiety levels are up, your heart rate's up, your heart rate and your blood pressure are up. And all of that is the adrenaline that is going back and forth. And the only way to quell that is just 5 minutes of deep diaphragmatic breathing. You could quell it even further. If you do 15 to 20 minutes, it is even more beneficial and will help you get to a state of calm, and eventually, in the case of insomnia, be able to help you fall asleep. It's a technique very similarly used in yoga nidra, a part of yoga, which is a technique used to help you fall asleep. You're kind of like half awake, half not awake, but then it's getting your brain calm so that you can fall asleep fully. So for me, this complements who I want to be. I am the lifestyle medicine pharmacist, and it fits in well with that. with the restful sleep and the stress management component of lifestyle medicine. And I use that technique. That's the technique that one of my most successful patients in the past 4 or 5 months has done. I just say, keep breathing longer, keep doing it longer. And you have to think of it as a dose, just like there's a dose with a medicine, dose for CBD. There is a dose for your breath work as well. And there is a lot of data on this.
Mm-hmm.
The other thing in the meditation world, when I saw some of the research from neuroscience world published, now a lot of the neuroscience research doesn't hit the PubMed medical research. But when I started some of that stuff like transferring over, the work by Richard Davidson at University of Wisconsin, who is a big mindfulness researcher, and he researches the neurosciences of it. And he uses mindfulness-based stress reduction technique. That's a strategy within the whole world of mindfulness. There are many others. There's metta, which is loving kindness meditation. There's walking meditation. So many different methods out there. But Richard Davidson actually utilized, brain scans of people who were novice meditators all the way up to advanced meditators. And what he showed, just on background, 20 minutes a day, 20 minutes a day for 2 months completely changes the neural network in our brain. Now, I have never seen one medication that would do that. Not one, not yet. Maybe psychedelics, but not prescription meds that are out there. Mm-hmm. None of them do that. In fact, if anything, as people get older, those medications take away parts of your brain. So again, as a pharmacist, I'm not trained to look at brain scans, right? But when I saw the brain scan, I saw the brain scan pre-meditative practice, and a month in and 2 months in, I was like, holy moly. Mm-hmm. I'm actually seeing changes in the brain without them even pointing out. So what happens is, what they call white matter in the brain, when they look at it in the scans, not good. The more gray it becomes, the more denser it is. And what that's suggesting is neuroplasticity, that our brain and our mind can learn and relearn things. So these are the types of things that when I started seeing this evidence come out, I was completely floored. And I said, why are we not recommending this? And you look at any antidepressant, any medication for anxiety, if you look at the way that they were studied, everyone in that study, even if they got a placebo, they get counseling therapy. That's background for everyone. But we don't carry that out in the real world. So that's why the placebo group also tends to have a huge effect in that trial, anywhere from 25 to 45% effect in that trial, the placebo group, hence the placebo effect, because those people think I might be getting the real study drug. The study group, they also get an effect, and they get about somewhere between a 45 to 70% effect. So there is overlap, as you can see. And because of that, even though the drug does get approved for treating depression, anxiety, bipolar, etc., how it actually gets implemented in the real world is most of the people are prescribed the drug, but they don't receive the counseling. Mm-hmm. And I see this a problem, even a bigger problem, in people who are on Medicaid than they are on Medicare. But still, it's a nationwide problem. I feel personally, any physician or a nurse practitioner is prescribing antidepressants is not practicing evidence-based medicine if they're not also providing counseling services to that individual. So that's why these people can definitely benefit from utilizing apps that will help them with some of the coping components. They can use journaling. There's two excellent journaling books that I recommend for my patients. One of them is called Therapy Notebooks, and you can Google it, Therapy Notebooks. It's specifically for anxiety, and it utilizes cognitive behavior therapy approach. And the other one is the 5 Minute Journal, which focuses on positive mental attitude development to help address depression and anxiety. So all of those things, cognitive changes, the drug doesn't do that. You have to do that. And you can utilize, hemp extracts to help assist some of it, and to help quell some of the anxiety. But you still have to do the work of thinking about things and thinking through things.
Mhm.
So these, for me, mindfulness and meditation and breath work are absolutely essential. It is something everyone should do. And if you look at all the high level CEOs in Silicon Valley, that's what they're doing. Yes, they are getting up at 5 a.m. or 4 a.m. and they have their crazy rituals, but at the end of it, they're always sitting down in some sort of meditative process, and they are doing deep breathing exercises, and they're journaling.
Mhm.
Key things. Um, so from a yoga meditation perspective, this is what I believe. You could use other things to help, assist that: aromatherapy, red light therapy, drinking out of a copper vessel. I mean, there's a lot of stuff that's out there. That's your personal preference, but the 6 pillars of lifestyle medicine are absolutely crucial in implementing and freeing yourself from having to see us as often as you do.
Yes, I like how you referred to it before as liberation. That's a great way to put it. And I like that focus on that's the end goal, is to not need this help because you become self-sufficient and find these ways. So when I speak to our community for this interview show, I'd like to leave them with a takeaway or an action item, to, if you will, so that way they could put it into action right away, or put it into practice right away today to benefit their health and well-being. So we talked about meditation and yoga and hemp and breathing and different pharmaceuticals or different ways around pharmaceuticals. So what would you say is the, and diet, too, what would you say is one thing that someone watching this could leave with today and put into practice today to benefit their health, their mental state, their well-being?
Well-being is multimodal approach. One size doesn't always fit all, but it does include multi-level strategies. And this is the function of us lifestyle medicine practitioners. Nutrition, what's on your plate, activity, do something that you enjoy. If you love doing CrossFit, go for it. If you love bouldering, go for it. But don't do it as a chore. Okay, do it because it's good for you. Even microdoses, 5 to 10 minutes of activity every so often spread throughout the day are good. Manage your stress, sleep better. And this is where hemp products and yoga, meditations, and deep breathing exercises can be of massive help. And reduce your need for substances. And I will add opioids on top of that. There is anecdotal evidence that cannabis products can reduce our dependence on opioid products. So again, another place where hemp products could be used as a support tool. And then focus on relationships. Obviously, if there are toxic people in your world, they may not serve you well in the short run, and maybe even in the long run. But once you get to that level of acceptance and understanding and start inculcating this pure love, and others see that, you become that beacon of light for them. And those toxic people will come to you because you are that beacon. They're in darkness and they're seeking your light.
That's a fantastic way to put that. So, several action items that we could walk away from this interview with. Thank you so much for sharing this wisdom with us. And for our community, if you would like to connect with Dr. Rohit Moghe, we will put some links in here that you can follow. Thank you so much for joining us today. We really appreciate you sharing this all with our community. We have a lot to get started on.
Yeah, but you know what? And I appreciate you, allowing me the opportunity to speak what I truly feel that most of us practitioners are clamoring for. We want people to take health into their own hands.
Yes, absolutely. Well, thank you so much. And until next time, everyone, bye for now.